Let's talk tourniquets. You may have heard that if you choose to use a tourniquet, it's a choice between life or limb, that you may save a life, but the limb below the tourniquet will be lost. That's just not the case. Modern tourniquets can be safely applied for up to 2 hours with little or no negative effects. I strongly encourage you to use a tourniquet that has been recommended by the Committee on Tactical Combat Casualty Care, as they determine the products used by our men and women in uniform. Today, we'll be using the combat application tourniquet. It's important to note that if you don't have a tourniquet immediately available when you need one, apply direct pressure, as we just described, until one becomes available. Start the tourniquet application by simply opening up the band. If you need to, you can completely open the band in order to thread the tourniquet around the limb. Alternatively, you can simply place the limb inside the loop of the tourniquet, as you see me doing here. The next step is to get the tourniquet as tight as you possibly can. We're going to do this by fully opening up the band and then pulling. And we want to pull as tightly as we can. We want to take every bit of slack that we can out of that tourniquet and get it as snug to the limb as we can. We'll then adhere the self-adhering band as far around the tourniquet as we possibly can, using up as much of that self-adhering band as possible. From there, I'm going to begin to stop the bleed, and I'm going to do that by tightening the tourniquet using the windlass rod. If you have secured the band as tightly as you can, it will usually only take between 2 and 5 turns of the windlass rod to get complete control of bleeding. Here, I'm going to turn twice. Once you have seen the bleeding from your wound stop, you're going to secure the windlass within the windlass clip on the tourniquet. At that point, take any remaining tail of the tourniquet and place it through that windlass securing clip, and then secure the tail and the windlass rod using the securing strap across the clip. As a last step, if you have something to write with, place the time that you applied the tourniquet on this strap. If you don't have anything to write on the tourniquet with, it's important to note the approximate time that the tourniquet was applied and relay that to first responders when they take over patient care. So why is it so important to make the tourniquet so tight? If you do not tighten the tourniquet as much as possible, you may stop the veins from continuing to bleed, but the arteries, because they're thicker and under higher pressure, may continue to bleed. To prevent this, we should tighten the tourniquet a bit more. There, now we've stopped the bleed. One topic related to tourniquets about which you may hear some debate is exactly where on the limb the tourniquet should be placed. Many people will instruct you to place it approximately 2 to 3 inches above the actual wound. Alternatively, and often in the military or law enforcement arena, you will hear it taught high and tight, meaning that you place the tourniquet as far up the limb as you possibly can. There are reasons for both, and as we mentioned, it is safe for a modern tourniquet to be on a limb appropriately applied for approximately 2 hours without any negative consequences. For that reason, either of these positionings is reasonable. It's also important to avoid joints. Never put a tourniquet directly over a joint. It's not going to hurt the joint, but because of the specific anatomy of our body's joints, it will not be able to control bleeding as efficiently. If you apply the tourniquet and have made it as tight as possible, and the bleeding is still not controlled, apply a second tourniquet if one is available. Apply it right next to the first tourniquet and tighten it just as we did with the first one. 2 tourniquets will occasionally be required to stop bleeding, especially on a large leg or thigh. If a second tourniquet is not available, apply pressure to the wound as we discussed previously. Once a tourniquet has been applied, leave it on. Some of you may have been trained to loosen it every so often. Do not loosen a tourniquet. Paramedics or physicians will remove the tourniquet if necessary when appropriate. By loosening it, you can lose precious blood, which is bad for the patient. It's important to note that it is possible for a person to have an amputation or a partial amputation of a limb with little or no bleeding. You should still place a tourniquet on the limb. Without it, at some point the blood vessels will relax and life-threatening bleeding will occur. If you're going to practice, and we definitely recommend that you do not use a tourniquet that you plan to use in real life. Designate a specific tourniquet for training. Additionally, we strongly encourage you to contact your local hospital, trauma center, or fire department and take a Stop the Bleed course. They'll only take about an hour and a half of your time, and it will increase your capability and confidence to save a life.